Great. Well, thank you everyone for joining the first ever virtual office hours with the Congressional District Health Dashboard. My name is Sammy Breslin. I'm the program supervisor for the Health Dashboards project. We are housed out of NYU Department of Population Health at the NYU School of Medicine. And the Health Dashboards project is a team at DPH that runs both the Congressional District Health Dashboard and also the City Health Dashboard. And we have office hours for both of these sites. But today we're going to be focused on the Congressional District Health Dashboard. And these virtual office hours are meant to be, they're small, they're informal. We want everyone to be able to ask the questions that they have. And really we want it to be a conversation. I will start off with, just an introduction about our website, who we are, the work that we do. Then I will go into a website demo and I'll show you all of the different facets of the website. And then we'll come back to some slides about, or in this month, focusing on our data release that we had earlier this month. And kind of walking you through what we've updated, what we've improved, as well as some analysis and trends that our team looked at. But again, this is very informal. Please feel free to leave your questions in the chat, and then we'll go over them at the end of the call. But if you feel so inclined to take yourself off mute, we'd love to hear from you that way as well. But all very informal, and we want to be able to serve you all, wherever you are. So with that, I will just share my screen. Okay. And is everyone able to see my screen, the PowerPoint? Great. Okay. So who are we and why did we come here? We launched the Congressional District Health Dashboard earlier this year in January. And we did that to really fill a gap. And we saw that there was a really large challenge that, congressional districts were facing, or policymakers, leaders, representatives were facing in terms of being able to access at a wide level, rigorous, objective, nonpartisan data about health and the various drivers of health. At that congressional district level. That data exists at the county level, at the state level, or at the city level with like a tool like our website, the City Health Dashboard, but it didn't exist at the congressional district level. And we saw that there was a lot of levers of policymaking that was happening at that district level. So there was a gap in that data availability. Sometimes the data was available, but not for every district, or there was a paywall, or it wasn't really a broad view of health or the drivers of health. So we wanted to create a tool to really fill that niche. And so our goal along those same lines is to provide that data and that granular data at the district level. We want it to be unbiased. We want, folks across the political spectrum, across the country, across data expertises to be able to find value in our tool, in our features, in our data to help them, inform policy making and catalyze priority setting. And, like I said, we sit at the NYU School of Medicine. We are an academic institution, so we get the power of data. But a lot of people, need that extra information to help them, reveal what is happening on the ground, or validate what they know to be happening on the ground, or validate, challenges that they've kind of seen firsthand, or that they've talked to people about. And so data is really helpful in revealing those challenges, but also revealing assets and opportunities. Data, like I said, can help inform our policy making. It can inform the decisions that we make. We want to make sure that we are as effective and efficient as possible with scarce resources, and data can help us kind of inform that strategy and inform that implementation. And then finally, data is a really useful tool to help us hold leaders accountable. If we're advocates or community organizations, or just, concerned community members, we want to be able to hold our electeds accountable to the promises and the responsibilities that they laid out when we elected them. So who is the audience of the the Congressional District Health Dashboard? We built this tool off of our expertise and experience developing and managing the City Health Dashboard, which is a very similar tool to what you'll see with the Congressional District site, but instead of providing the data at the Congressional District level, we provide it at the city level and the neighborhood level. And that site we have found has been most valuable because it is so accessible to people, regardless of, if they are a total layman, have never really used data before, don't really get data, are not numbers people, they find value on that site. But we also find that like the data analyst or the PhD or the epidemiologist can find a lot of value from the site as well. So being able to meet people where they are in terms of their expertise, the sector that they work in, the level of government that they work in, we wanted to be able to capture all of those audiences with our tool. But that being said, the bread and butter of our audience members, we see as elected officials, but really more so their staff, advocates, journalists, the media, researchers, but also, again, concerned citizens, people like, just who want to learn more about what's happening in their community. And so when we set out to create this tool, we wanted to have a broad look, a really comprehensive look at health and the social determinants of health. So much of health today is not impacted by our DNA or by our genetic code, but instead of by our zip code, and the things that are happening in our zip code. And so we wanted our tool to have that breadth, to still be curated, but have a really like 360-degree view of health. So we have things like, and we have 36 different measures on the site right now, broken out into 5 different domains. So the first being health outcomes, the things that you would expect to see on a health website, diabetes rates, life expectancy, premature deaths. But also you can see that most of our measures actually are those social drivers. So social and economic factors like broadband connection, health behaviors, clinical care, and measures of the physical environment. So it's pretty broad. And then the measures that are listed here that have like an asterisk next to them, those measures or those metrics have demographic breakdowns available by either race, ethnicity, age, or sex. And so with that, I will turn us over to the website, which is accessible for free. As long as you have an internet connection, you can access our site anywhere at any time. There's, like I said, there's no paywall. Nothing is kind of gatekept. Everything is accessible to everyone. All you need to do is go to congressionaldistricthealthdashboard.org, and you'll be able to get access to all of our metrics and data. And so I will just pull that up. Okay, so this is the homepage of the Congressional District Health Dashboard website. And you can either enter your district here just by typing it in or searching it on this list, or we have this navigation bar, which takes you through different features of the website. So you can kind of follow this in order or just kind of jump into your district. Whatever whatever fits your journey or fits your workflow the best, like we have different options for how to engage with our site. But for the purposes of this demo, I do want to start with metric maps. And so when you hit metric maps at the top, you're brought to a list like what we just saw on that previous slide. And you can click into any of these measures. So today I want to explore, for example, uninsured rates. Uninsured is, very much on top of mind. It always is, but just with the pandemic emergency kind of ending last month, where people are thinking a lot about, Medicaid expansion, health insurance. And so this is why I want to kind of focus on insurance today. And one of the good things about the website is that once you kind of get a lay of the land for how we talk about things, how we present data, the colors that we use, the symbols that we use, once you understand and see one metric, you know how everything works across metrics and across places. So when you come to the metrics map, the metric map page, the first thing, I look at is obviously the national map, where you can see, pretty much at a glance where areas are struggling and which areas are thriving. So at a glance, this area in the Northeast and the upper Midwest is doing better. And we know that because we have this scale bar here, which represents the range of values for a particular metric. So in this case, we're looking at uninsurance rates. And across all of our different metrics, lighter colors are portrayed or presented with or portray better outcomes, and deeper colors portray poorer outcomes. And this statement here, lower values have better outcomes, tells us the direction of those better outcomes. So for example, with uninsurance rates, you want less of your residents being uninsured. So the lighter colors and the lower values will be here. Whereas for a measure like high school completion, you want more of your residents or your citizens having completed high school or an equivalent degree. So the lighter colors would be on this side of the scale bar. And then this blue triangle represents the US average. You can also get more information about the metric here, how we measure it, the years of data collected. We just in June added a new year of data. So you now have, for about 22 measures, 2 years of data available. And then for people who are less kind of data minded, we translate this scale bar into this, what we call a sense making statement, which basically just puts the numbers into layman's terms into a sentence format. So the US had estimated 10% of adults who were uninsured in 2021. And so digging in, like I said, you can start to see trends at a glance. The Northeast and the upper Midwest are doing well. You're seeing a lot of lighter colors around here, whereas this southern corridor, kind of concentrated in Texas and Oklahoma, seems to be struggling a lot more in terms of their uninsurance rates. You can click in to any of these districts to get more information. And so you can see, the color, the district number, as well as the value, and you can click into the district here. You can also zoom in to get more information about a state and kind of see in more detail what's happening at the state level. So I'm looking at Texas, and you can really see the different variation in colors that indicate different uninsurance rates. So like I said, you can click into to see a district right away from that, but you can also type it in here or type in your state. So I will type in Texas, so we can see Texas. And then again, you're able to see just Texas on its own. And it's like, again, it's a similar scale bar that we just saw, but I'm interested in exploring Texas 15th, which I'm almost positive, if it doesn't have the highest uninsurance rates in the country, is of the highest uninsurance rate. So I just clicked into Texas 15 from the Texas state map, and you can see again a very similar page to what we had just seen. We have the sense making statement, that same scale bar, but instead now we're seeing the value or the estimate for Texas 15th as compared to the US average. So 30.5% of residents or of adults in Texas 15 were uninsured in 2021, as compared to the US average of about 10%. So sadly, they're doing a lot worse than the rest of the country. You can also, I want to draw your attention to this comparison value. So the default is to compare the district to the US average, but you're also able to compare to your state, which is very important for a lot of people, representatives from different districts who are kind of jockeying for resource allocations to basically against different districts in the state. So it's useful to see those district by district comparisons in your state. So now, instead of seeing the US average, we're seeing the Texas value. So again, Texas 15 is still doing worse than the overall Texas value for this measure. And so now I do want to just show you a new addition that we created, or that we launched also in June of this year, is that we now we've added census tracts to the dashboard. So that's not a default. That has to be turned on through or clicked into through this right here on the left-hand side. But, when we're looking at districts or we're working within districts, it might be, we always say at the dashboard, like the more granular the data, the better. The more information it provides you, the more context that you get, and just the more you're able to understand what is happening at a really local level. So for people who do business or do, policy making or do organizing within districts, it might be important to know what's happening, not just at that district level, but actually within districts. If I'm a representative and I'm trying to, improve uninsurance or improve broadband, I might want to see what's happening across different neighborhoods in the community that I serve. And so we have the ability to do that with the addition of census tracts. So let me just zoom in because the colors are a little bit lighter. So you're still seeing Texas 15, but instead of just seeing that like really, really dark purple, which is just the district value, you're now seeing each of the individual census tracts within within Texas 15. And so there's a lot of variation between within different census tracts. Like there are actually some census tracts in Texas 15 that are doing quite well. It's being a little bit slow at the moment. I think it's because I'm sharing my screen. But there is a lot of districts that are doing well. And then there's, of course, districts, particularly down in the South, the southern kind of region of the district, that are doing much poorer. So, this census tract in Hidalgo County has 50% uninsurance rates, whereas this census tract in Jim Wells County, Texas, has 12%. What is happening in these two tracts that is accounting for these really, really big gaps in uninsurance? So that's the addition of tracts. You can also, if you know your tract numbers, you can find them here. But I also want to for example, I want to show you that you're able to do, so I just am copying and pasting the tract number. And so it pulls, when you put it in the tract, it pulls it up. And then you can also highlight it by clicking this eye icon to see where that tract lives on the map, which is pretty cool. And this saves. So if you go to a different metric, go to a different district, or even leave the Congressional District Health Dashboard website and then come back, the tracts that you highlight will be saved, as long as you don't clear your cache or clear your browser history. And then I also want to just bring attention to the fact that, like I said, we have at this point, more than 1/3 of our measures, we have demographic data available for those measures. So, and uninsurance is one of those metrics. So where that data is available, like I said, not every data source provides data disaggregated by race, ethnicity, age, or sex, but when that data is available, we will always provide it. Given that there's not any censorship or small numbers, we always try to provide as much data as possible. So for uninsured, we actually have data disaggregated by all three of those different demographics: age, sex, and race, ethnicity. So you can see the uninsurance rate broken out by different age groups, across the sexes, as well as across the 5 major racial ethnic groups. So, so this is, really important information to see, because we always want to take a racial equity lens when we're looking at these things. And we don't just want to have a geographic lens for exploring challenges that our communities might be facing. And it's important to know how the different racial ethnic groups relate to each other to help us kind of meet the needs of those communities and really provide resources that are effective and targeted towards communities that need them. So this is, important information to show. And I will just flag that, that there's no data available for the Black population, and that's because there's just there's not enough when the population is too small, there's just not enough data that we can kind of stand behind. It's not as accurate or it's not as stable. And so when that happens, we will not present that data. So then I do want to just go over to the district snapshots. This is a really great, so for when we were developing this site, we had a lot of focus, or we hosted a lot of focus groups where people said that they want, quick and easy facts that they can give to their boss or give to their representative or give to their their elected officials, whether it was like for talking points or speeches or whatever it is. They wanted like a quick, easy to use, easy to consume overview of what's happening in the district. So we have created that with this district snapshot. I will just show you New York 10th, which is my district. And so the district snapshot has two facets up to it. The metrics overview, which is what we're looking at, which is you're able to see all of our measures listed alphabetically, as well as, the estimate for that metric. So for example, we're looking at air pollution. You can click into each metric that takes you to that district's metric map. You can see, the estimate for, New York 10 or whatever district you're looking at, as well as a comparison to the US average. And so we drive those comparisons using these symbols. So it's green is better than the US average, the green circle. Yellow triangle means around the US average, and the red square is worse than the US average. So I'm seeing a lot of around the US average for New York 10, some greens, and then you can see how New York 10 compares to the US average here. And then when you hover over that statement around the US average, you'll actually see what the US average is for that metric. And so in this chart, you're able to print this chart in like a nice styled format, so you can kind of just like print and like send it off. So you can see the domain that each metric belongs to. So health behavior, health outcomes, social economic factors, and you're also able to filter this list by domain. So if you're only interested in looking at how your district is doing on the social and economic factors domain, you can just click that, and you'll then only see those measures that belong to that domain, also in alphabetical order. If you're also interested in clinical care, the list expands. And then finally, district facts just has some general demographic information about the district, as well as who the members of Congress are. And then I do want to just flag, I'm not going to go into it today, but all of our data for the website is accessible for free through downloading CSVs. Through this access the data page on the site. So all you have to do, there's a short survey. We don't spam you at all. We just want to collect some information about like your email and like what you're using the data for, although like most of the questions on the survey are not mandatory. So all of our data is accessible through this page. And so then going back to the slides, I do want to just flag the data release that we just had earlier this month. So the things that we've added: census tract level data for 24 metrics. So I showed you how to access census tracts on the site. And so the 24 metrics that have that sort of data or that level of data available is 24 metrics. So whenever that data is available, you will see that for your district on the website. We don't present census tract data for states or for the national map. We also added a new year of data, 2021, for 22 metrics. So all of our data that, or all of our metrics that are drawn from the CDC's Places Project, as well as the American Community Survey, now have 2 years of data and the most recent year of data available, which is 2021. We've also improved the user experience on the metrics overview tab. I just showed you, the filtering and having those domains listed. That was not something that we had when we first launched in January. And then the metric maps pages, the ability to highlight or find tracks. Those are all new things that we've updated. And so when we added, the census tracts and the new years of data, we wanted to dig into, any trends or patterns that, we could find in the data. Sometimes you can't find those trends or those patterns, but usually there's something to be found. And so we decided to look at 4 different metrics and just, what was happening, whether at the tract level or year over year. So the first is rent burden. So we looked at, how rent burden across the country changed from 2020 to 2021. And so we found that, roughly 61% of districts, their rent burden increased between 20 and 21. And you can see that reflected in this map on the right-hand side of the slide. That orange color indicates all of the districts, where rent burden increased in 2021. So most of the map, or more than a majority of the map, is that orange color. And you can see there's a lot of districts within the South, the Midwest, and the West that experience more rent burden as compared to the Northeast. People like to say that, the Northeast has, some of the highest rent burden, the highest rent prices in the country, but we're actually seeing that, again, that Southern corridor, the West, struggling a bit more when it comes to increased rent burden amongst their residents. We also looked at children in poverty year over year. And this chart here kind of shows us the top 5 districts where rent burden increased, and the top 5 districts where rent burden decreased. So here in purple, these are the 5 districts that had the highest increases year over year. So children in poverty is getting worse in these 5 districts. So for example, New York 12 had a 15.5% increase in their poverty rate between 2020 and 2021, whereas Arizona 6, for example, had a 13.3% decrease in their children in poverty rate year over year. So what's happening in New York 12 and what's happening in Arizona 6? And so the dashboard is helpful for kind of identifying, just changes over time, or is helpful for is beginning to show us how, these issues change over time. Of course, you can only see so much in one year, but as data gets updated, we plan to include more years of data moving forward. We also looked at uninsurance rates and found that, Texas too had the largest increase in uninsurance residents between 2020 and 2021 at 11.5%. And New York 17 had the greatest decrease in their uninsured rate between those 2 years. And then finally, broadband access. So for broadband, we didn't look at change over time. We actually wanted to see variation within districts now that we have tract level data available. Like I said, sometimes when we're looking at larger geographic areas, challenges might be washed a bit. You might not be able to see the full scope or breadth of an issue as it's being felt by really local communities. And so the addition of tracts helps, eliminate that problem, or at least address it. Obviously, tracts are approximations of neighborhoods, and there's individual populations, individual households, and we can't quite get to that level yet, but at least census tracts brings us much smaller than the district level. And so, like I said, looking at variation within a district shows a much more nuanced picture of any metric that you're looking at. So broadband access is top of mind, just given the pandemic, ARPA, infrastructure. Broadband's on top of mind for a lot of folks and a lot of policymakers. And so, and it is one of the metrics where census tract level data is available. So we looked at the top 5 districts for broadband connection, as well as the tract ranges within those districts. So these 5 districts, Virginia 11, California 17, Georgia 6, Washington 1, and Maryland 8, have the top are the districts with the most residents connected to broadband, or the highest connections to broadband. So Virginia 11 is the most connected district in the country at 91%. But when you look at the tract ranges, you have some tracts, one tract or maybe more tracts with 100% of their residents or their households connected to broadband. But in at least one tract within the district, only 26% of the district is connected. So that's 1 in 5, or sorry, 1 in 4, excuse me. That's a really big difference between 100 to 1 in 4. So, and like just looking here, like that's a 74 percentage point difference between the least connected district and the most connected district. And you're seeing, pretty large ranges in all of these districts. So again, we want to, the goal of our site is to provide, as while keeping it manageable and curated, like I said, but to provide as much context and comprehensive information to help, users in whatever they hope to, in whatever they're doing with the data, whether that's just getting a general knowledge, a general sense of what's happening, help them, craft a journal article or a research paper or a newspaper article, and getting the context for an issue. If it's, a policymaker who's looking to implement a policy or a program, helping them be as effective as possible and be as data-driven as possible. And so with that, I will end the formal presentation, but I do see that there's a couple questions in the chat, which is great. So I will just start kind of going through these. So the first one from Gail, does this touch on any mental health statistics? Yes. So we provide a measure that is called frequent mental distress. So that's taken from the CDC's Places Project. And it is, I think, like the percentage of the, I think it's the percentage of the population that has reported 30 or 14 or more bad mental health days in the past 30 days. Then the next question is, we also have, sorry, I should mention this. We also have a measure of firearm suicides, which gets to, of course, the mental health aspect of the dashboard. Then the next question is, what are the trusted data sources? How is the accuracy determined? Great question. So accuracy, or the trusted data sources that we use we take from all federal data sets, all national data sets. So like I said, the American Community Survey, which comes from the census, the Places Project, which is out of the CDC. We have data from the EPA, from the National Vital Statistics System, that is the nation's birth and death records, all very trusted sources. We are, like I said, we are an academic institution, so analytic rigor, trustworthiness is, one of the most important pillars that we stand by. And one of the reasons why we as a team are pretty conservative in terms of, documenting everything that we do, all of our analytic decisions, documenting, or when it comes to censoring, estimates or suppressing estimates when there's, too few numbers or too rare events or whatever it is, like we always take the more conservative view. When things are potentially unstable or whatever it is, we always put that on the site. Like it'll be kind of indicated by a tooltip, or like it looks like an eye in a circle, and you'll see that caution indicator. So yeah, like trustworthiness and accuracy is like, that is like, again, part of our mission. In terms of how is the accuracy determined, I'm not sure, Gail, if you're asking for like the actual like analytic methods that we use. If you are, I can't speak to that myself, but I know, just because I'm not a data analyst, but our team uses only the most trustworthy, accurate analytic methods, geospatial methods to determine the estimates for our site. But if you're interested in learning more about that, I suggest we have a technical document which you can access at this website, or at the website at this URL, excuse me. Or feel free to email me, and I can connect you with a representative on our data staff who can answer any more technical questions that you might have. So I put my email in the chat. Okay, questions. What happens when the districts are redrawn? Great question. So the districts were redrawn in just this past year for the 118th Congress. We did all of the redrawing for the site and plan to do so as the districts get redrawn in the future. So we were actually the first site nationwide to have this sort of data aggregated for the 118th Congress when we launched in January. So, we were the first people to redraw, to actually use the redrawn maps to map out health and social drivers of health for the nation. So yes, we plan to redraw the districts on the site and represent that once that happens in the future. The next question is from Sherry. Is the plan moving forward to always have the historical data available, including the representatives at the time? So we don't plan at this time to go any further back than 2020 in terms of the data that we provide, but so we launched in January with 2020 data. We just added 2021. And so moving forward, as more data becomes available year over year, we will add future years of data, but we probably won't at this point add anything prior to 2020. And as the representatives change, obviously we have an election coming up in November. The site will update accordingly, but we won't have like a historical record of all of the representatives that were elected to that district, if that makes sense. Would a commercial use of the data provided from your site be permitted? Yes, like I said, our data is totally free and accessible. Our data is downloadable. And so that's, we just ask to be cited and to be sourced as, or to be cited as the source of the data. But yes, we want our data being used broadly, whether it's for, like I said, research articles, media, what have you. I'm not quite sure what you mean by commercial use of the data. If you want to maybe you could either ask another question again or take yourself off mute, Sherry, or you can hop off if you don't want to share that with the full group, you can stay on at the end. That's fine. And that is the last question that I'm seeing. But if anyone has any more questions, I'm happy to take those. Either in the chat, or if you want to go off mute, that's fine. Okay. Well, seeing that there's, oh wait, one new question. Hold on. Yeah, to use and to develop your own mobile app. Yes, like I said, I think that would be okay, just as long as we're cited. But if you want to email me, Sherry, I can maybe just follow up with you. Just because I haven't heard of that particular use case yet. Not to say that it wouldn't be okay. But if you want to just follow up in an email, or once everyone logs off, we can talk about it. But with that, I will give everyone 20 minutes back in their day, but thank you so much for joining us. We plan to host these on a regular basis, if not every month or every other month, but definitely at least quarterly. And the format will be pretty similar, where we'll have like that intro, a site demo, and then we'll dig into a focus area as it comes up. So yes, that's it. But I put my email in the chat, so feel free to email me or email us with any questions or concerns or comments. And we look forward to seeing you on the site. Thank you all.